Well, when we talk chest surgery involving the heart and lungs, you know it's serious business. And we are on your side today speaking with Dr. Andrew Papoy, a cardiothoracic surgeon with Princeton Baptist Medical Center. And he joins us virtually right now. Hey, Doc, how you doing?
I'm great, Sheldon. How are you?
Fantastic. So I guess the obvious first question is, what is cardiothoracic surgery?
So cardiothoracic surgery is really, it can be divided into two categories. You have cardiac surgery and then general thoracic surgery. Cardiac surgery, which is what I do, focuses in on repair and replacement of the blood vessels and valves associated with the heart to repair or correct blood flow problems. General thoracic surgery deals more with both cancerous and non-cancerous treatment of disease of the lungs, esophagus, lymphatic system, and chest wall.
Yeah, well, when you come to what you do as a cardiothoracic surgery, what type of issues normally associated with that?
Yeah, as a cardiac surgeon, I treat mainly disruptions in blood flow. That means that a vessel is too narrowed, carrying blood to the heart, or a valve is leaky or too tight. I can typically bypass the vessel that's narrowed or replace or repair the valve that's too tight. Oftentimes when I meet my patients before surgery, they're suffering from chest pain or shortness of breath, which can be lifestyle limiting. Other times the blood flow can be so poor that it could be emergency and require an emergent surgery. Regardless, we just do surgery for two reasons: to help people feel better and help them live longer.
Yeah, that sounds like a very extensive type of procedure, is it not? I mean, how do you do that?
Yeah, it really, there's a great deal of variety when it comes to heart surgery. That can be something very minimal and or minimally invasive, as we say. Regardless of the severity, it's all very complex, and a lot of what we do is dictated on trying to get the greatest benefit out of the least amount of cost to the patient, cost being pain and recovery.
Yeah, and so when you talk about the recovery, how long does that normally take?
And it depends on the magnitude of the initial operation. So a lot of our advancements recently have been geared towards trying to achieve the same long-term benefits, but not subjecting the patients to the pain in the recovery period. An example would be if a valve is too tight, oftentimes I can fix it through an IV in the leg, which the patient can go home after a day or two and usually are recovered within a week. If they don't qualify for this, I can still most of the time fix or replace the valve through a small incision in the chest, and they usually go home 3 or 4 days and are fully recovered in 2 weeks.
Modern medicine.
Regardless of the magnitude, it's complex, and it's important to keep in mind, though, that not everybody's the same, and right. Some patients are very sick and take much longer to recover.
Yeah, and you basically treat people of all ages, whether it's infants up to older adults. Am I right?
Cardiothoracic surgeons do. I specifically treat adults who are 18 or over and some adult congenital problems, but there are cardiothoracic surgeons in general. There's subspecialties that also treat pediatric illness.
Dr. Andrew Papoy, thank you so much for joining us. Keep up the good work. Just amazed at modern medicine and the job that you're able to do. Thanks for joining us here at noon, okay?
Thank you.
Fred, try to top that.